And now Healthline with award-winning medical correspondent Phil Rainier.
Welcome back. The Centers for Disease Control now lists Louisiana among a handful of states with widespread swine flu activity. Yesterday, the state announced the 8th H1N1 death here. Meanwhile, people continue to flock to Baton Rouge area clinics thinking they may have swine flu. Many are given a type A flu test. If it's positive, the CDC says to consider it H1N1. But the emphasis is shifting. It's becoming less about testing and more about plans to dole out the newly approved swine flu vaccine. Doctors I've talked to say they'll recommend it.
I think the manufacturing process and the oversight of quality processing by the FDA has improved tremendously in the last 10 to 20 years. And this vaccine, swine flu vaccine, novel H1N1, should be every bit as safe as the regular seasonal flu vaccine. It's basically the same vaccine except for just tweaked different protein antigens.
It should be.
Now, the H1N1 vaccine, which is expected to be available to high-risk groups by early to mid-October, is mainly, at first, will be for pregnant women and other people at high risk. Pregnant women, obviously, are at the top of the list. On 9 News at 6, we'll hear what one Baton Rouge mother-to-be has to say about
taking... If you're on the list of people considered most at risk, should you get the swine flu vaccine?
It's supposed to be available by mid-October, but as Phil Rainier tells you in our 9 Healthline report, that's not doctors' biggest concern right now.
Okay. This woman's being tested to see if she has type A flu, which at this point is being treated as H1N1.
I think I may have it.
But the emphasis in Baton Rouge area clinics is shifting. With an FDA-approved H1N1 vaccine expected in Louisiana next month, doctors are now hoping to convince patients to get it. Those with the highest risk of dying from H1N1 will be first in line. Women who are pregnant top the list. Katie Porcio works in the healthcare field and still isn't sure she'll get the shot.
I have the same concerns as everybody else with it being so new. I still would like to talk to my obstetrician about it. If he really recommends that I do it, then that would probably be my deciding factor.
Cherie Johnson is part of the strategic H1N1 planning team at Women's Hospital.
I do feel that pregnant women should be vaccinated because those are the ones that we're seeing more complications with.
Women's Hospital is the largest labor and delivery hospital in the state, which pretty much makes it ground zero for any swine flu vaccination being given to pregnant women. Officials say the state won't formalize a list of inoculation sites until it gets more specifics from the federal government. In the meantime, Johnson hopes she can separate myth from reality when it comes to the swine flu vaccine.
There's been some press out there about Guillain-Barré syndrome, and this hasn't been tested long enough, and those types of things, but we have no evidence of that with any of the research that we've done with the vaccine, or the FDA wouldn't have approved it.
When the time is right, Baton Rouge physician Jeff Burnham says he'll recommend the H1N1 shot to most all his patients.
This vaccine, swine flu vaccine, novel H1N1, should be every bit as safe as the regular seasonal flu vaccine. It's basically the same vaccine except for just tweaked different protein antigens.
Thamina Spears is 11 weeks pregnant and considered high risk because of it. She's done her research and says she'll get the H1N1 shot.
With any vaccine, there's risk, but the risks are minimal.
Healthcare providers hope women who are pregnant and anyone else in a high-risk group will take that message to heart and get the H1N1 vaccine. With Healthline, Phil Rainier, WAFB 9.